largely by the insurance industry.
Let's go to another clip of Sicko, of Michael Moore's film that they all so feared that they sent one lucky staff member, employee from CIGNA, to the Riviera to watch the film festival where Michael Moore got a standing ovation for 15 minutes and then have a corporate conference call to report back on what they saw. This is Sicko.
This guy broke his ankle. How much will this cost him? He'll have some huge bill when he's done, right?
Here, NHS, everything is free.
I'm asking about hospital charges.
Yeah.
You're laughing. Even with insurance, there's bound to be a bill somewhere. What'd they charge you for that baby?
No. Everything's on.
This is NHS.
Yeah, it's not America.
So this is where people come to pay their bill when they're done staying in the hospital.
No, this is the NHS hospital, so you don't pay the bill.
Why does it say cashier here if people don't have to pay a bill?
Those who have reduced means get their travel expenses reimbursed.
So in British hospitals, instead of money going into the cashier's window, money comes out. Yeah, they look at me like I'm from Mars when I'm asking the Brits, you know, how much they paid for, this, that, or whatever.
We're talking to Michael Moore. Let's talk about how we arrived at the system we did in this country.
Well, my grandfather was a country doctor, actually. He was from Canada. He went to medical school in the late 1800s, which was a year then. It's about pretty much what they knew back then. They could teach it in a year. And so the little village where, I was raised, because my mom was from there too, because he was there. And, he was paid with eggs and milk and chickens and things like that. He didn't do it to make any big money. They didn't make big money then. They were comfortable, the local doctor, but they weren't the rich man in the community. We got away from the concept of treating people because it was the right thing to do. The nuns ran the hospital that I was born in. The nuns weren't doing this to turn profit and invest in Wall Street. They did it because they thought that was their duty to serve God and serve mankind by opening hospitals and delivering babies. We're a long ways from that now. Somewhere we let profit and greed enter into this, and in the film I peg a certain date when the HMOs really got their start, and I got very lucky. I had a 23-year-old researcher in my office who worked on the film, who was actually someone I believe that was recommended by Jeremy Scahill. So there's a Democracy Now! Connection to this moment in the movie. But he found this Watergate tape. It has nothing to do with Watergate. It's one of the Nixon tapes at the archives, National Archives, where Nixon and Ehrlichman are discussing whether or not to support this HMO concept. And Ehrlichman says to Nixon, you're going to love this because this is private enterprise. This isn't like some freebie thing. And Nixon goes, oh, I like that. Well, tell me about it. And then Ehrlichman says, this is how it's going to work, these HMOs. They're going to make more money by providing less care. The less care they give them, the patients, the more money the company makes. And Nixon goes, ooh, not bad. And it's all there on tape.
Wendell, you were laughing as Michael's describing the Ehrlichman tape, the Nixon-Ehrlichman-Haldeman. You know this tape.
I do know that tape, and it was, I think, a great find.
Did anyone ever tell you look a little like John Haldeman?
Thank you. Maybe, I don't know. But and it was important for that conversation. The conversation was very important because at that time, Ted Kennedy was trying to get legislation enacted that would have been a Medicare for all system, in which we would have had a single-payer system in this country. So Nixon was desperate to find some private enterprise solution that could be used as a counter to what Ted Kennedy was trying to do at that time. It's very important.
I want to go back to Healthcare America. This is really important, what you've just been describing. This AstroTurf organization that's quoted by the New York Times and other publications and media as a consumer healthcare group, but it isn't, that's sitting in APCO, made by Arnold and Porter, who represented the tobacco companies. And they're there to kill any idea of public option or anything like that. What other organizations are there? And how successful did you think you were in dealing with Sicko? Did you think you contained the message?
There's no doubt we felt we were successful in blunting the impact of the movie. We were concerned that the movie would be as successful as Fahrenheit 9/11 had been, and we knew that if it were, it really would change public opinion about our healthcare system in ways that would be harmful to the profits of health insurers. So it was very important for this campaign to succeed. At one point during a strategy meeting, one of the people from APCO said that if our initial efforts were not successful, then we'd have to move to an element of the campaign to push Michael Moore off a cliff. And not meaning to do that literally.
Are you sure?
Well, I'm not sure. To tell you the truth, when I started doing what I'm doing, I was concerned about my own health and well-being, maybe just from paranoia. But these companies play to win, and we're talking about some big bucks at stake here. Billions and billions and billions of dollars.
So what were they talking about when they said, if this doesn't work, we're going to push them off the cliff?
Well, it would be just an incredibly intense PR effort, if necessary, to spend more premium dollars to defame Michael Moore, to discredit him even more as a filmmaker.
So were you doing research on him?
Oh, yeah.
You were going personally?
Well, I was a part of the effort. That was part of the reason for hiring APCO and to work with the trade association, is that it relieved me of the responsibility of doing that kind of work. You paid for it to be done by people who were experts in doing that kind of research.
But they were doing an investigation into him personally?
Well, absolutely. We knew as much about him probably as he knows about himself.
About his wife, about his kid.
Oh, yeah. You know, it's important to know everything that you might be able to use in some kind of a campaign against someone to discredit them professionally and often personally.
And did you use that?
You use it if necessary.
Did you use it?
It was not. We didn't deem it necessary to push him off a cliff because we were very mindful of the box office totals. We looked at that every weekend to see how well it was doing, and we could see that it was not getting or drawing the audiences like Fahrenheit 9/11 did. And we thought that the efforts of Healthcare America and our allies were succeeding.
When the film came out and you did the research, did you feel that you actually had contained it at the beginning? I think of a CNN critique that Sanjay Gupta did. Sanjay Gupta did.
Right.
Did you have anything to do with that?
I didn't. Again, some of the reason you hire these big PR firms is you can do this with a little bit of a hands-off kind of operation. The big PR firms have very good connections with producers of network shows and cable shows and columnists and pundits, and so you rely on them to be able to get your messaging out. And they're very, very successful in influencing people about how they write or how they put a show together.
I mean, he was furious. Michael Moore went on CNN, was outraged, and said that everything they said about him wasn't true. And in the end, CNN had to apologize.
Yeah.
They were not correct, what they said about Michael Moore's film, that he had gotten his facts wrong.
I think CNN and Sanjay Gupta undoubtedly were embarrassed that they had been, frankly, duped by the insurance industry, probably not even aware of the role that the insurance industry was playing.
Did the insurance industry put out to all the networks? You had your chosen producers at all the networks fact sheets on Sicko?
Not directly. Again, that's why you hire these third parties, these PR firms, to do it for you, so that your involvement cannot be traced.